Hi, I'm Dr. Len Dobrin. I'm an endocrinologist in Mountain View, California. And this video is for some general information, mainly for my patients, but I thought I would share it with the world, with YouTube as well. This has to do with influenza and people with chronic medical illnesses, in particular, in the case of many of my patients, type 2 diabetes or type 1 diabetes. A lot of this also applies to people with other chronic medical conditions such as asthma, rheumatoid arthritis, other autoimmune diseases, or situations where their immunity has been impaired by medications. This is not meant to be specific medical advice for a particular patient, and you should always consult your own physician for advice in your case. Okay, now the reason I'm doing this video. This is because of influenza. The H1N1 influenza strain, which has been called the swine flu, is with us and is now contributing to a significant number of cases of influenza. People with diabetes and these other chronic medical conditions that I told you about do poorly with influenza compared to otherwise healthy people. Now, the most important thing is prevention. In addition to prevention, we have to be aware that you can get infected, and a lot of people will get infected. So recognition of treatment is important because now we have partially effective treatments for influenza. So rapid recognition and then action to obtain treatment. Okay, prevention is very simple. It's what we do in medicine all the time. That is hand washing. Hand washing before you touch your eyes, your nose, your mouth, or before you eat. And you may also wash more frequently during the day, during influenza season. This prevents many, many infections. Recognition. Influenza is a specific illness. In this case, now we have various strains of influenza, which might be a little bit different, but generally, it's a specific syndrome of chills, high fever, headache, and total body aches. It's not a bad cold. A cold usually starts as a scratchy throat, a runny nose, you're not sure if your allergies are out of control, but then may develop into something worse, with worse coughing. You may have very low-grade fever, but usually you don't have chills where you have to pile on the clothes or get under the blankets. And usually you're able to do most of your daily tasks. You may go to work and spread it among your friends and colleagues. But influenza people generally, within 12 to 24 hours, it's evident that this is something different. Again, chills, fever, usually over 101 in an adult, headache, and whole body aches. In addition, there may be cough, and especially with the H1N1 virus, there may be gastrointestinal symptoms. But in the setting of a epidemic, about 80% of cases are going to be those four symptoms, or three of the four symptoms which I mentioned. So that's recognition. Now treatment. There are two treatments that are partially effective for treatment of influenza. One is Tamiflu, which are pills. The other is Influenza, which is an inhaled medication. Both of these medications have their biggest effectiveness if they are used starting the first 24 hours of the illness. Between 24 and 48 hours after the onset of the illness, they have less effectiveness, and after 48 hours, they have very little effectiveness, but they're still used in bad cases. So what we want to do is we want to recognize early on that we have this disease, and my patients are instructed to call their primary care physician, report their symptoms, and get treatment. And this means the first day, if possible. That means calling on a Friday night, or Saturday, or Sunday. My primary care colleagues are going to hate me for this, but it really needs to be done. And you can get started. Now, There may be a reluctance to use these medications, but they are available. We have paid for 50 million doses in this country, and hopefully they will be distributed for use. But there may be a reluctance to use them. My patients have been instructed to tell their primary care doctor that their symptoms, and if the primary care doctor agrees that these are simple symptoms suggestive of influenza, then the patient may remind their primary care doctor that they have a chronic medical condition with which they do less well with influenza. So then they can be treated rapidly and have the best outcome. And that's it. So it's avoidance, recognition, and early treatment for the best outcome. Thanks.